Welcome to Shore and Port. This induction video will provide you with an overview of how we manage health and safety to make sure everyone goes home safe and well daily. In this section, you'll find out about our general arrangements for health and safety and how they apply to you. At Shore and Port, our number one commitment is to make sure we all go home safe and well daily. We consider everyone who works, visits, or makes use of the port environment to be members of our community. We are committed to providing a safe and healthy environment for all members of our community. In return, we expect everyone to respect the port's policies, rules, and safe systems of work, act reasonably, be well behaved, and show respect to others, and carry out their work or activities in a way that safeguards their own health and safety and that of anyone else who could be affected by it. Our health and safety policy demonstrates our commitment to health and safety here at the port. It is reviewed and updated every year. You will find copies of it on our health and safety notice boards, and it is also available on the virtual notice board on our health and safety hub. The port has a number of legal responsibilities to colleagues, visitors, and other members of the public. Directors and managers are responsible for managing health and safety in their teams. Advice and guidance is provided by the health and safety team. Written risk assessments should be carried out for any significant risks across the port. Safety instructions or method statements are produced from the findings of these risk assessments and form the basis of any training provided. The risk assessments and safety instructions should be reviewed at least annually. You have health and safety responsibilities too. All colleagues have a duty of care to keep themselves and others safe by following the health and safety arrangements we've put in place, including our health and safety policy, other policies and procedures, and general health and safety guidance which is available on the Health and Safety Hub. Your line manager will help you to understand any local arrangements which are specific to your role. The health and safety team is here to support you if you have any questions. Local notice boards contain important information which you should read. Your legal duties in respect of health and safety are to take care of your own health and safety, to take care of others who may be affected by your actions or inactions whilst at work, and to cooperate with the port as an employer and other colleagues to help everyone meet their legal requirements. Remember, if you feel something is unsafe, you have the power to stop work and raise the concern. We carry out risk assessments at Shore and Port to ensure that risks are controlled to a level which is as low as is reasonably practicable. Risk assessments look at the things that could cause harm, the likely that someone will be hurt, and what actions we can take to reduce this risk. Standard operating procedures, sometimes referred to as safe systems of work or method statements, will be developed based on these risk assessments. These describe how you should carry out particular tasks and the equipment and PPE you may need. You may also need a permit to work to carry out certain tasks, such as hot work, working at height, working in confined spaces and in excavations, as well as working with stored energy. Your manager will let you know if this is necessary for your role. The port is a safety critical environment which is hazard rich in nature. This is why we have introduced an impairment policy, which is in place to make sure that everyone is safe to carry out the tasks asked of them, and they don't put themselves or others at risk. It is essential that you can focus on what you're doing to keep yourself and others safe. Reasons for being impaired may include extreme fatigue, medication including prescription and over-the-counter medication, stress and anxiety, medical conditions, or the use of drugs and alcohol. Given the nature of the work that is carried out at the port, it is essential that you are not impaired through the use of drugs or alcohol whilst working here. As part of our impairment policy, the port carries out testing for the use of drugs and alcohol on a regular basis. We use a breathalyzer to test for alcohol and oral fluid to test for drugs. This is carried out in-house on a random basis. It can also be used on what is known as a for-cause basis. This is where there is reasonable suspicion that a person may be under the influence of drugs or alcohol. It may also be used as part of an investigation into an accident or incident. You must inform your line manager if you feel you are impaired in any way which may put yourself or others at risk whilst you carry out your role. This can include through prescription or over-the-counter medication. In some cases, we may need to make temporary, reasonable adjustments to your role to make sure you and others are safe. There is also support available for colleagues, including through the Colleague Assistance Programme. The Safety Improvement Team meets regularly and is set up to share key health and safety information and discuss current issues and concerns. We have 4 formal sessions each year, and in between these run topic-led sessions, which have a different focus each time. These sessions are supported by the SIP members and are open to all colleagues to attend. Every team has a representative within the Safety Improvement Team, and you can contact them if there is anything you would like them to raise. If you're not sure who they are, your line manager will be able to help. When you joined us here at the port, you will have completed an onboarding health surveillance questionnaire. For certain roles, ongoing health surveillance is required. If this applies to your role, your line manager will let you know. This section of the induction covers our emergency arrangements for fire and first aid. Fire detection. Fire detection systems are installed in various buildings across the port estate. Activation of a detector or a break glass cool point causes the alarm to sound. Manual break glass cool points are installed at final exits and may be at other locations such as staircases. In operational areas where there are no manual cool points, a loud vocal alarm of fire, fire, fire may be used to raise the alarm. In the event of a fire, the most important thing is for colleagues to evacuate the building. Make sure you know your escape routes. These may not be the way you entered the building. You should also make sure you know where the break glass cool points are, your local fire exits, where fire extinguishers are located, and where your assembly point is. Only colleagues who've been trained to use fire extinguishers should use them. If you're not sure of any of these points, please ask your line manager. Fire action notices are displayed at appropriate locations across the port and confirm where your assembly point is. Some colleagues may require a personal emergency evacuation plan or PEEP. Where these in place, the colleague should follow the actions agreed within their PEEP. Looking after visitors. If you have a visitor, you are responsible for them while they are on port. Make sure you let them know if there are any planned fire drills on the day and what to do if they hear the fire alarm. In the event of an emergency, you should accompany your visitor to the muster point. We can all take actions to try and prevent fires. This includes checking that smoke detectors are not covered up or missing, making sure that fire doors are not wedged open or damaged in any way, making sure that fire door closers are not faulty or broken. If fire extinguishers are empty, damaged or missing, make sure these are reported. Make sure fire exits and stairs are not blocked or obstructed in any way. And flammable and combustible materials should not be left in corridors or on fire exit routes. The port has a number of fire wardens, sometimes known as fire marshals, who are trained and appointed for buildings across the port. In the event of a fire alarm, their duties include checking their designated area to ensure that individuals have evacuated the building. They will report to the assembly point coordinator to confirm that the area has been cleared and provide any other useful information. On the activation of a fire alarm, all colleagues and visitors should leave the building immediately and proceed to the designated assembly point. Remember, you are responsible for any visitors you may have and should ensure that they make their way to the muster point. This slide shows the type of fire extinguishers you may see in the port. Do not use these unless you have been trained to do so. It also shows the types of signs you will see throughout the port, including prohibition signs, which are signs which prohibit behaviour that is likely to increase or cause danger. For example, no access to unauthorised persons. Warning signs, which are signs that warn you of a particular hazard or danger. For example, electricity. Mandatory signs, these are blue signs which tell you what you must do. For example, wearing eye protection. And green signs, which highlight emergency escape routes and first aid. There are nominated first aiders across the port estate. Their contact details are provided on notice boards in the areas in which you work. First aid kits and defibs are also positioned at strategic locations throughout the port. Please make sure you know who your local first aiders are and where the first aid kits are located in your part of the business. This section of the induction explains how we manage accidents and other incidents which happen on port. When dealing with an accident, it is important that you deal with the immediate issues first. Call for first aid or emergency services if required. If it is safe for you to do so, make the area safe. Let your line manager know what's happened and report the accident using the My Compliance system. You should submit this report as soon as possible, and in any case, on the same day the incident has occurred. If you're unable to complete the form for any reason, ask your line manager or a first aider to help. It's important that you provide information on the report which is accurate, detailed and factual. Certain injuries and incidents will be reportable to the HSE under the RIDDLE regulations. You don't need to worry which these are, but the health and safety team will review and deal with this if necessary. All accidents will be investigated to understand the causes and to take steps to prevent a reoccurrence. Accident reports may also be used for insurance purposes or for other business purposes. All other incidents, including near misses and safety observations, should also be reported. You can use the QR code on this screen to do this. Please report these on the day they occur. Near misses will be investigated to ensure that we learn from them and take action to prevent anyone from being harmed. Remember, see it, sort it, report it. If you see something that's unsafe, if you can safely do so, take action to make it safe and let us know what you've seen and what you've done about it. This section of the induction covers what we do to maintain a safe workplace, including manual handling, housekeeping, COSH, VALS disease, PPE, testing and inspection of work equipment, and the use of display screen equipment. Where your role involves manual handling, you will receive training to make sure you know how to do this safely. When carrying out manual handling, firstly, plan. Think, can you handle the load safely by yourself? Can a lifting aid be used? And what other hazards exist in the area you are working in? Secondly, posture. When you're lifting, keep your feet apart, slightly bend your back, hips and knees. Keep shoulders level and face forwards. Keep the load as close to your body as possible and don't overstretch your back. Finally, the actual lift. Raise the load while straightening your legs. Keep the load close to your waist. Keep your head up and move smoothly. Reverse this procedure to put the load down. Effective housekeeping can help control or eliminate workplace hazards by keeping the area tidy, removing slip and trip hazards, and removing waste materials that could cause fires. Poor housekeeping can be a cause of accidents, such as slips and trips, being hit by falling objects, and injuries resulting from protruding or poorly stacked items, including nails, wire, or strapping. You may come across hazardous substances as part of your role at the port. These can take many forms and include things like chemicals, fumes, dusts, vapours, gases, biological agents such as germs, and other germs that can cause diseases such as leptospirosis, also known as Vahl's disease, or Legionnaire's disease. Products that have hazard symbols on them are classed as hazardous substances. You will receive training on this which is appropriate to your role. The use of hazardous substances is controlled under the Control of Substances Hazardous to Health regulations, known as COSH. Under these COSH regulations, the port has a number of responsibilities. These include preventing or controlling exposure to hazardous substances. This may include through the provision of appropriate PPE, implementing control measures, and ensuring that these are maintained, kept up to date, and in full working order. Providing information, instruction, and training around working with hazardous substances. Having procedures in place to deal with accidents and emergencies relating to hazardous substances. Ensuring that those colleagues who are exposed to hazardous substances have adequate health surveillance. Ensuring that COSH risk assessments are carried out and communicated. Making sure that any hazardous substances used in the workplace don't exceed the limits set out for them. And checking that colleagues are carrying out tasks the way they are supposed to. Colleagues also have a number of responsibilities. This includes assisting other colleagues to create a safe working environment, following procedures which are put in place to stop accidents and overexposure, wearing the correct PPE and ensuring it's stored correctly in the appropriate place, reporting all accidents, spillages and breakages immediately, attending medical checkups and health surveillance appointments as required, and keeping up to date with any training provided. Before you start work, ensure that all controls are in place and you're aware of any emergency procedures related to the products you are using. Given the nature of the port, it's important that you're aware of a condition called leptospirosis or Vahl's disease. This is a bacterial disease that affects humans and animals and is treated with antibiotics. It is spread in the urine of infected animals such as rodents, bats and dogs. You can catch it if soil or fresh water, such as from a river or canal, containing infected urine gets into your eyes, mouth or a cut. For these reasons, it is really important that any open wounds are covered when working in the port. The typical symptoms include a very high temperature, headaches, feeling and being sick, aching muscles and joints, red eyes, and loss of appetite. If you experience these, contact your doctor and make sure they are aware of where you work. The minimum PPE required in operational areas includes safety footwear and high visibility clothing. Banksmen wear yellow to distinguish themselves from other colleagues who will wear orange PPE. Other PPE may be required depending on the type of work you are doing, such as the use of head protection, ear protection, eye protection, hand protection, fall arrest or restraint, and life jackets. You will be informed by your line manager and through the local risk assessments and safe operating procedures which PPE you should wear. Inspection and testing of work equipment. The need for and frequency of inspection of work equipment is determined through risk assessment. Inspections can vary in what they cover and may include pre-use checks, weekly checks, or thorough examinations. Thorough examinations may be carried out every 6 months or 12 months, depending on the type of equipment. Records must be kept of all but the simplest pre-use checks. Your line manager will explain which checks you are required to do as part of your job and how they must be recorded. Colleagues who regularly use display screen equipment will be asked to complete a DSC risk assessment and training on a yearly basis. This will explain how to set up your workstation and will also highlight any issues which need to be corrected in the working environment or with your desk and equipment to keep you protected whilst at work. The risk assessment should be repeated if anything significant changes, for example, a change in office or desk, a change in personal circumstances such as pregnancy, illness or disability. If you're unsure, please have a chat with a member of the health and safety team for more advice. The DSC training and assessment are carried out on our online training system. If you need any help accessing this, again, please contact the health and safety team. All colleagues who regularly use DSC also have the right to a free eyesight check. This section deals with the training, guidance and support available to you in relation to health and safety whilst working at the port. We will ensure that you have the right training to do your job safely. This may include formal training courses, online training through our iHasco system, or informal or in-house training courses. It's important that you complete any training courses that you're asked to undertake. The Health and Safety Hub is your central resource for everything related to health and safety, including policies, safety instructions, guidance documents and information, safety improvement team meeting slide decks, minutes, and much, much more. Please take a look and make sure that you're aware of everything that's on there. If you have any questions or feedback, please get in touch with the Health and Safety team. The Health and Safety team is available for information, advice and guidance on all matters related to health and safety. If you have a question, comment, feedback or a concern, please do get in touch. Thank you for completing this health and safety induction. Please now take a couple of minutes to complete the knowledge check by scanning the QR code or following the link in this presentation. This helps us to make sure that you have understood all of the information provided. If you have any further questions, please speak to your line manager or get in touch with the Health and Safety team.